Also, also, it's lovely to see so many familiar faces. Um, and just to follow up from what Kevin said, I have now left my teaching position at La Trobe and I have an adjunct position there, but I still do some teaching at a couple of other universities. And my work at La Trobe is now based mainly around, apart from a bit of supervision, academic misconduct and the dreaded AI.
Oh dear.
So something we've got to deal with. I have a small private practice, which I still do, and I still see some people across the age span. So children from 3 up to, I did have a 90-year-old man. But it's so nice to be involved with Speakeasy. It's a very special group. And David really gave me a bit of free hand. And so what I thought, given your background and the role of Speakeasy, is that I would try and present a little bit of a summary for you and a bit of a challenge, and then we can have a chat. I'm very happy to be interrupted as I go. So either raise your hand or talk. I won't always see the hands. They tend to be quick, but I don't mind being interrupted at all. But I thought perhaps a little bit of rundown of the status quo and some changes that may or will, some of them will affect you, some of them won't, and a bit of a challenge for why we're all here and what you expect to get from Speakeasy and what you put in. So what I will do is try and share. Oh, I can't share my screen on this.
David, do you know how that
Are you able to, is somebody able to co-host, give me a co-host and I can share, please? Thank you.
Right.
Okay. Yeah. Here we go. Hopefully you can all see that.
Yes, we can.
Yes.
Good. Great. Okay. Let me just, there we go. All right. Still got it?
Yep.
Okay. So look, as adults, it absolutely grieves me to say that you're dealing with a chronic condition, and that's got very significant implications. It grieves me because I would like to think that we have been able to change the chronicity for you, meaning that, you know, you could grow out of stuttering, or that with treatment it doesn't have the same impact, or you come along to Speakeasy because you can contribute and not necessarily have to focus on maintenance or whatever. Now, certainly with young children, I feel very positive. Young preschoolers and school-aged children don't always grow up having to manage a chronic condition. But what does that mean? And what does it mean for you? You know, what has it been like dealing with this thing forever and a day? And what's been the impact? And they're questions that I think, you know, often we don't spend enough time thinking about, because it's a very significant fact in people's lives. And medical conditions get a lot of focus. If you've got a chronic heart condition, you're regularly checked, you might be on medication, if you've got any other sort of chronic conditions. But when we come to adults who stutter, it's not dealt with in the same way that other chronic conditions are dealt with. And that's not only from the motor coordination aspect, but also from the well-being and psychological aspect. And also, where are you in terms of changes over time? We change. Each decade brings different challenges and different benefits. And where are you at the moment? Danny said, you know, I look around or I go to the meetings and it's nice to be the youngest one there. What does that mean? And what does it mean for the older people there? And how do the changes that we experience, and I'll talk a bit more about those in a minute, how do they impact how we function and what we get out of a group like Speakeasy? And then what do we know about stuttering that has changed over time? And then how have treatments changed? And we'll look at each of those. So if we think about a chronic condition, something that you are growing up, and what we don't want is that young people grow into stuttering. It can vary over time, and that is something that can be extremely frustrating for you to manage. You know, some weeks it's great, some weeks it's not so fluent. You can have months at a time that are easier to manage, or days at a time, or across a day. It varies. And that's really frustrating to manage. And of course, we all know the impacts of well-being, the burdens that come with managing stuttering or managing fluency, managing the variability of this particular sort of condition. And then, of course, you know, those factors lead to anxiety, and we can talk more about that. But no small thing as a consequence of having a chronic condition. So what does this chronic condition mean for you individually? What issues do you experience? Anybody like to make a comment about what it's been like to manage this over a lifetime?
And anxiety?
Yes.
It's more of a fear and anxiety for me.
Yep. More of a fear?
Yeah.
Yep. And I'm sure other people experience that. Go on, Padma, sorry.
Oh, yeah, no, I was just going to say that I manage it by doing meditation.
Yep.
And recently I've tried this new technique called emotional freedom technique, where they have these tapping points. And that also releases a lot of stress.
Well, I must say, in my younger days, not so much now, I used alcohol.
Yeah.
I thought if I could get myself full, I would sound fluent. But of course, because I got so full, I couldn't remember if I was fluent or not.
And it's not a very healthy way to manage.
No, it's not. But I mean, at the time, that's what I did. I've survived, and it's it's just a very, and I've got a constant battle with life and kids and grandkids and everything else to find the time to maintain practice, and that's why I'm really enthusiastic about the Zoom meetings, because if you're from the country, it's very hard to drive 3 hours a night. You can't do it.
That's a very, very important point and a good point.
Excuse me, Sue, excuse me.
Yeah,
would you just put yourself, would everyone put themselves onto mute if there's any noise in the background, please, so we don't interrupt, that's all. If there's a background noise or an animal having been talking, just put yourself on mute if you wouldn't mind. Thank you. Sorry, Sue, go ahead.
Yep. So, Gerard, you pointed out a good point about the practice and, you know, how do you fit it in, and that's why Speakeasy provides a very important role in that it's a scaffold for your managing, which is good. And so, you know, if you can identify what's going on, how do you manage that? And in your case, you know, you come to Speakeasy because it's a point. In Padma's case, you know, you manage some of the impacts by doing meditation or doing other things that impact your well-being. The point really is, if you do nothing, nothing will change. And different things can be effective at different times. But I think we need to address the fact that we might need to do something. And knowing that you need to is quite different from actually doing it.
Yes.
And then we've got the issue of, you know, life changes, our individual life changes. What happens as we age? You know, we get slower, we get more forgetful, we get, it takes us longer to do things. But changing life changes can also mean changes in attitude. You know, maybe we don't get so worried about certain things. We can put things in a different context. Or we don't change the attitudes that we have, and then we get sort of stuck in a rut. And health can also have a big factor. You know, as you get older, different health issues emerge, and they can impact your speech. They can impact your ability to concentrate. They can impact your ability to focus on fluency, if that's what you want, or getting to meetings. You know, you're slower to get around if you're getting arthritic. There are all sorts of things that can impact health-wise. And also, as life changes and as we age, our focus changes. You mentioned, Gerard, you know, you have children, you have grandchildren, you change jobs, you move from one life stage at work to another, whether you get promotion or whether you decide that you're going to retire. And the speech and stuttering can change focus. And we need to think about that and look at, do we need to do something to manage that, or does it change the burden of stuttering? Because what we want is that burden is reduced. And then if we think about it, you know, what is the change in knowledge? What's happened with stuttering over the years in terms of knowledge development? And we know that for a larger group of people than we had thought in the 70s, 80s, 90s, anxiety has a bigger impact, a much bigger impact for a subgroup of people who stutter. Not everybody gets anxious when they go to talk if they're a person who stutters. Some people really avoid talking. The impact is so great. We've heard Ross Menzies talk about social anxiety and social phobia. That's the extreme. But what steps do we take to manage the anxiety and to change? So anxiety's become much more to the fore in treatment. And a lot of treatments now incorporate strategies to manage anxiety. looking at causation. What do we know causes stuttering? When I was a student, we didn't even sometimes listen to the child. The parents must have been doing something wrong. Terrible. The guilt you would instill in parents. So we know that there is a neurological factor. We know that a certain percentage, about 60% of people who stutter, have a relative who stutters. And so there is something to do with genetics. And there's a big international genetic study on at the moment, and some of you have probably participated in it, whether you've given blood samples or saliva samples or whatever. So causation has had a different focus. And we also know that locus of control in terms of maintenance is a very significant factor, that we need to see ourselves as responsible for the behaviours we exhibit, given that we can control some of those behaviours. And in the case of stuttering, that we can see ourselves responsible for how we talk. If we've got some strategies, that we use the strategies and not become overwhelmed by stuttering and the consequent anxiety, and therefore can't make the change that we want to make. And if we think about anxiety in particular, as I said, we've got more refined treatments. Most treatments now would incorporate transfer, would incorporate conversation with other people into the treatment, not just with the clinician. And many of you may have tried the iGleeb program that was developed at the Australian Stuttering Research Centre for anxiety. Now, that's very much looking at challenging the thoughts that we have that lead to anxiety, trying to help people not avoid, because we know that avoidance perpetuates anxiety. And so looking at giving people strategies to change how they think about talking, how they think about anxiety, looking at evidence for what we think when we get anxious. And I certainly can remember discussions at Speakeasy in Melbourne where one participant said, I spend so much time worrying about stuttering that I forget about listening to the conversation. And therefore, I lose the thread of what the conversation is. And so looking at how we change our focus through things like the iGleeb, the cognitive behaviour therapy program. But there are lots of other psychological approaches that can also help. And we can talk about some of those for people who are interested or who might have tried them. And so we come to this sort of question about what lets you know that you might be anxious. Now, I don't mean stating the bleeding obvious, where you're sitting there sweating and thinking, I'm not going to do this. But what are the signs that lead up to anxiety? Do you slow down? Do you think, oh, I can't do this? What do you know that is a sign for you that you're getting anxious? And we know there are physiological signs that, you can get an increased heart rate. You can sweat profusely when you're anxious. There are all sorts of things that give you a sign. But how do we react when that happens? How do we react when you and hold your breath because you're worried that you might stutter? What do we do about it when you get those signs? Do you just lie down on the road and let the stuttering and the anxiety roll over you like a steamroller? what strategies have you got and how do you put them into practice? And very often, they're things that we ignore. Danny, you've got a query or a comment?
Oh, yeah. Hi. So I was just going to comment on, this is probably more back in the earlier years. These days, it's pretty good. But yeah, I mean, signs, definitely things like going back to my old tricks, like word avoidance, situation avoidance, all those things, was the signs that,
Yes.
yeah. And then what did I used to do about it? And sometimes I guess still do about it is, first thing is just realize that, okay, I've got to be a bit on my sort of best behavior here, speech wise, or not necessarily, or cool, might be a bad day today, or not a bad day. I don't like using words like bad. My speech may not be as fluent as it normally is today. And that's cool. Or I might, I was going to do this or that, or, so it's just deciding how to manage it. If I have to say something, then, use more of an obvious level of technique for myself personally.
I think that's a good point. How much does it worry you at the time? If somebody is wanting to be fluent or to make any behavior change, you're only going to make the change if you hate it enough. And if you think, look, it doesn't matter if I stutter in this situation. My friends know me. I'm just not going to spend the mental energy trying to be fluent. Perfectly reasonable if that's what you want to do in that situation. But if you think, okay, I really want to get on top of this in this situation and I want to be fluent, I've got some strategies. But if you then start to think, I'm feeling a bit wobbly, and you don't do what you said, Danny, which was maybe slow down a bit or use your strategies a little bit more deliberately, then you're going to be potentially disfluent because you're doing nothing to prevent it. And it's not a matter of us as clinicians making you feel guilty about it or you individually feeling guilty about it. It's what can I do about it and did I do it? Because avoiding, I've said it before, avoidance just increases the anxiety or perpetuates the anxiety. And that's not helpful for anybody if you're trying to reduce your level of anxiety. If you never have a go at it, if you never take a risk, then, what's the worst thing that would happen if you took a risk when you were anxious and used your strategies or spoke, even if you stuttered? You're not going to die from a moment of stuttering. You've all experienced stuttering. It's how you manage it. And each time you do it, you get better and better generally. But continuing to avoid just maintains the anxiety. Sophie.
Hi, Sue. Ebele had something he wanted to say.
Thank you. I didn't see the hand.
No problem.
Yeah. Thank you. I don't know if you can hear me.
Yes, thank you.
Okay. Just yesterday, my name is Ebele. Okay, I joined from Lagos, Nigeria. I am presently at work, but I took out time just to make sure I attend this session. Okay. Somebody called me yesterday. One of my colleagues way then over about 30 years ago when I was in the secondary school. I was the senior prefect of my school at that time. Even against all odds, I didn't want to be the senior prefect because of my speech issue, which obviously many of my classmates and even my teachers did not notice. But I know I struggle with speech. They just felt I was good enough to be a senior prefect, and they voted me, and I got it. Okay, so he called me yesterday and said, back then, my classmates then, I had so much trust in you. I respected you. Obviously, I am not where I feel I should be after 30 years of living secondary school. And he was telling me that that he has so much, that the confidence he has in me is more than the confidence I have in myself, because I was so good back then in academics in most things. But I felt I have always struggled. I avoided speeches up till now. I still do. But the trouble for me now is that I have a 6-year-old, my son, who appears to stutter. And my journey this session today, well, basically it's not for me. I'm already in my late 40s. I know I've advanced much in my career, though I haven't done, I'm not really where I felt I should be, because I avoided a lot of speeches here. But my 6-year-old, I want to help him to avoid the terrible roads I passed, over the decades. And that is why I'm actually attending this session. Yeah, so thank you.
Oh, thank you. Did you say you're not in Australia?
No, I'm in Lagos, Nigeria.
Yep.
I joined from Africa.
Yep.
Yes.
Well, I guess, there's quite a lot online about what you can do to help children who are stuttering, and, certain things that you can do to make sure that they don't become too anxious about talking. So you will all know what individual things made a difference to you and what didn't. And one of the things that people talk about is being made to feel good about yourself in general, and that the stuttering is not necessarily such a big deal. That it is a big deal to that individual, but we want to put it in the context of a lot of other things. You're a smart 6-year-old, you're a clever possum, you're good at doing X, Y, and Z. I love listening to what you've got to say. And the fact that you sometimes have bumpy talking is very annoying. But, in the absence of treatment, all you can do is boost the person's self-confidence. But let's hope you get something out of tonight. We can talk about it a little more at the end. Yes,
can
Jerry.
I just suggest, when I was with practice, I've got 3 grandkids, and one of them at one stage had, we thought, a stammer or a stutter just starting. And when I did a booster at La Trobe, one of the student clinicians, the best advice I've ever had was, with practice for me, every time I spoke to my grandchildren, especially the boy who had an issue, the clinician or the student said, why don't I use that time just to use all my techniques and slow down as practice? And that helped also my grandson. And I think it certainly helped, and he's grown out of it. But just the fact, every time I spoke to him or went to the house, I straight away zoomed right into slowing down and all the techniques.
It's a very good point, because we know quite a lot's been written, especially in the 80s, about parents might be contributing to stuttering by talking too quickly. Yes. And I don't think that's the issue. I think the issue is, if you slow down, the turn taking, the child has more time to think about what they're saying and to get the words out without the time pressure. So slowing down's got a very significant point, I think, for young children, because it takes the time pressure off the conversation and the need to reply quickly. We know that a lot is happening neurologically in terms of looking for causation. Angela Morgan is a speech pathologist, but an international researcher at the Murdoch Children's Research in Melbourne, Institute in Melbourne, and she's done a lot of work looking at stuttering young children, and looking at what is the neural basis. Why are some children stuttering and others aren't? And looking at MRIs and just looking at what we can do, and looking at tracking children who might be at risk to stutter and children who develop stuttering and children who don't, and do their brains look any different? And so looking at MRIs with young children, and what they do is perform a function, and they look at brain activation, and the grey matter is the bulk of the brain and white matter is the linking part of the brain. And they're looking at linking the two hemispheres, and they're looking at what's happening in brain activation in the grey matter when the task might be saying a word or doing different sorts of activities. And what they've found is that people who stutter have more activation. Your brains work harder than my brain, especially when you go to talk. And it seems that the right hemisphere lights up more than the left in the brains of people who stutter. Now, that's an interesting finding. And what we want to know is in young children or people before they start to stutter, are their brains different in terms of the activation, not structurally, but in terms of what happens when they go to talk, and then as they start to stutter, what happens? And so it does look like structurally they're the same. There is some finding early on about some structural difference in a speaking system, which is what causes the right activation, but that it has not been found to be the case in such a simplified sort of way. And what ends up happening, of course, is with this neural basis, what came first, the chicken or the egg? And hence they want to track children. So, you know, Gerard, they might have been interested in you as an individual who then might have had a grandson who looked like they were starting to stutter. And, you know, can we look at, in terms of family patterns, what is happening? And they need a lot of data for this. There are a lot of studies that are very involved. I was involved in one with a family in New South Wales where there was a significant family history of stuttering across 4 generations. And with Angela Morgan, we took saliva samples and looking at just what differences we could find and whether there was a pattern. And looking at chromosomal abnormalities, and all that we could find at the time was that, you know, there was one part of one chromosome that looked like it was a bit different, but wasn't missing. And on the paper that we did looking at that, there were about 9 authors, all who had to make sense of the data. And I still can't understand the data. So it's very complex. And we're waiting for great big international studies to give us more detail. But what does it mean? What does it mean? What difference would it make? The only difference it would make to know that a child was more at risk of stuttering is they should get priority in treatment. And we already know that boys are more at risk. Children with better language skills are more at risk. If there's a family history, they're more at risk. If the child is unduly worried and reacting. So those children should get priority. And then if we think about what are the changes in treatment, the biggest change, I think, has been the change in focus. So what is the goal of treatment? And I've certainly been at conferences, and I know some colleagues who were at a conference in Rome last year or 24 actually had their paper interrupted by people, I've never been at a conference where that's happened, who said we should not be using the term treatment. That's terrible. We should not be endlessly focusing on fluency. And it's very controversial. Now, I make no apology to be focusing on fluency because the people who come to see me don't want to be stuttering. Now, of course, you've got to make sure that the individual feels comfortable in their own skin, that they are not overly stressed about stuttering, that they are not so anxious that they actually can't put themselves in a talking situation. But there is
Sue, sorry, it's Rowan Hayes.
Yes, Rowan.
Yeah, you just touched upon a point that seems to be almost universal, that it almost seems to me from my reading of things that it's only in Australia where we really focus on using a technique to, fluency shaping to improve fluency. And it just seems to me from what I hear of what happens in both the USA and in Europe, and I think also in Japan, that the focus is just simply on making stutterers feel better about themselves. And that's going to ultimately make them a happier person. It may not actually make them more fluent, but it'll make them more sort of self-satisfied with themselves. So I'm just interested, Sue, is it really true that Australia is a little bit unique, and maybe New Zealand, in doing the fluency shaping approach?
No, although I don't disagree with some of what you've said. No, I mean, certainly I've visited people in Bulgaria. I've visited people who learned fluency shaping and were doing it. I visited in the Michael Palin Centre in the UK, and while they have a different approach primarily with children, at some stage, if the child's stuttering doesn't resolve, they do fluency strategies. No, that's not the case. That, what Australians are is pretty direct. And, we don't namby-pamby around in general. I'm overgeneralising, I do realise. But, my goal, of course, is to make a person feel comfortable with themselves and feel comfortable about the fact that sometimes they stutter. They don't always stutter. And if that's enough, that's fine. But that's not enough for the people I see. For the people who think they're not being promoted because all being equal, they're stuttering and the other person's not, and they've got to be managing people and give presentations and whatever to boards, that they need to be fluent. And so I think, I think in general, our treatment is pretty good because it's evidence-based. What we don't have enough focus on is seeing people through the journey. And, one bout of therapy is enough when it's not. We need to be able to have people log in and out of treatment when they need it, and get a booster, because that's what you need when you're dealing with a chronic condition. So Australians are criticised for being gung-ho about fluency, because fluency shaping is where the evidence is for adults and older adolescents. And it's fine if somebody doesn't want to do that. But, for a person who wants to be fluent, we need to be able to help them change a focus on their strategies, put a focus on different sorts of aspects of strategies, if we look at self-evaluation, the Camperdown program is a version of prolonged speech or smooth speech, which focuses on you making a judgment about how you sound, rather than the therapist saying, oh, well, you're speaking at 60 syllables a minute, and it's not quite slow enough, I can't hear all the aspects. In Camperdown, you identify what you think the model, the person who's giving the model, is doing online, and then following it. And does it sound the same? How is it different? And then you evaluate. And they've simplified the process by having basically 4, extreme technique, 3/4 technique, half technique, and little or no technique, rather than, 60 syllables a minute, 120 syllables a minute, or whatever. So much more focus on helping the person take control, getting locus of control back. That's a long-winded way to answer your question, Rowan, but I think we do put a focus on treatment because we're speech pathologists, and that's why people come to us. And I've worked hand in hand with counsellors who are helping people manage anxiety when increasing fluency hasn't been enough to do that. Many people have speech-related anxiety, so when they're fluent, they no longer have that anxiety. But many people also have a significant degree of anxiety, and getting fluent isn't enough. They still maintain that anxiety.
Yeah, because just with my own personal situation, I've just found over the years I got very anxious, certainly around the time I initially saw you a long time ago, because my speech, I just had no control over my fluency whatsoever. But finally, over the decades, as I got a stronger and stronger hold on smooth speech, I felt, and I was able to, make a bit of a breakthrough on situations that I'd previously found very, very challenging, and just simply by using good quality smooth speech. And that, in my case, fortunately, just lowered my anxiety, because for the first time in my life, I was just essentially fluent by design rather than fluency by accident.
And fluency by hope. Yeah. So, you had commitment and persistence, and also at different times of our lives, we can manage things differently. So I think the change in treatment focus is something, and, it's very frustrating to go to a conference and have people say, well, we don't agree with what you're doing. Well, that's fine. But, where's the evidence for what you're doing? And if the evidence for, of course, increasing someone's well-being, that is highly significant. But my contention is fluency enhances well-being for many people. The changes in treatment, the cost of treatment, I mean, really. Yvette and Michelle can probably agree with this. There's nothing worse than having people ring around saying, how much do you charge for treatment? You think, oh my goodness, you just need treatment. Can the cost be the same everywhere or whatever? But cost rules a lot of people out, especially as now most people's available treatment is private, and an availability in terms of access to people who will work with stuttering. We've got so many so many speech pathology programs now, and a lot of students come out with not a lot of stuttering experience. Some good news is that Speech Pathology Australia has advocated to the government, and they have had, and some of you may have had, what's called an ECP or an EPC, an enhanced care package, where you can get 5 sessions of private therapy with a Medicare rebate. Well, now they've brought in this new from March this year, what's called an M10. And so for people under 25, they can have 20 sessions of treatment, several assessment sessions, and then treatment with a very significant Medicare rebate compared to what the other system is. But that's only for people under 25. So a very positive change for some people. So I guess the question is, now, why are you here? Why are you at this meeting? What are your goals, not only in the meeting, but at the present time? And what are you contributing to the meeting, and when you have a weekend away, what are you contributing? And what are you contributing in general? Because we know that, increased socialization can decrease anxiety and enhance well-being. And so you can do any amount of practice. You can do any amount of participation in a practice meeting like Speakeasy. But an awesome practice would be Radio for the Print Handicapped, where you read the news every day, or, you read a student's textbook, a blind student. So, great practice. What can you contribute that enhances your well-being and your fluency and makes another contribution, I think is a good way to look at it. And what help do you need to get your goals, to achieve your goals? Because we set goals when you first go for therapy, but your goals change over time. So I suppose as a challenge, write down your goals for this week, for the month ahead. What do you want to get out of what you're doing? And how can we then enhance that in terms of the Speakeasy meetings? And I just want to, there we go. Get some comments and maybe challenges that other people. Yes, Isabella, you wanted to say something, or have I missed other things in the chat? Ooh.
No, yeah, I've already made my comment earlier, so I'm not saying anything now.
All right. So what are your goals today that are different from what they were, and do you even bother setting goals anymore?
I'd like to make a comment.
Yes, Alan, hello.
Hello. Anxiety. Now, I guess we've all been anxious with respect to our speech, and even people who don't stutter must get anxious before they speak. Now, some number of years ago, I was tutoring a friend of mine. She was at the Conservatorium of Music at Melbourne University, and she was being examined in units. And she was really worried that she might fail a particular unit. And I said to her, even if you fail, you'll still be alive. And I mean, she was taking it seriously, and I fully understand that, and I wouldn't have tutored her otherwise anyway. But I thought she was a little bit too serious about it. And I feel that sometimes with our speech, I can understand we all get anxious, but I think at times we get over anxious and try to overachieve when we speak rather than being a little more relaxed about it.
I think that's a very sensible comment. And also, when I first graduated many moons ago, thank you to all you people who pointed out how long I've been going, there was a branch of therapy called personal construct psychology. And you remember Yvette. And what that focused on was helping an individual change their perspective of themselves by changing the thoughts they had about themselves. of course, that's what CBT, cognitive behavior therapy, does. But I can remember looking with one very nice young man who would have been about 24. And he was awesome. He was a fantastic football player. He played the guitar. He was a butcher, and he was managing a butcher shop. He was really doing very well, but he didn't have a girlfriend. And the only reason he said he didn't have a girlfriend was that he stuttered. And I said, well, let's look at all your positive attributes, looking at the positive personal constructs he had about himself. The only positive construct he had was his car. Well, ladies, I don't know, I mean, I suppose if someone pulled up in a Lamborghini and said, would you like to go out to dinner? I'd be thinking, oh, maybe. But there was so much more to him. And the stuttering was the whole negative that overtook everything. And so perspective is important, Alan, really important. But if somebody who is highly anxious is also depressed, they're not always looking at things in that sort of positive, constructive way. And it's easy to fall into that trap. Mm.
Yeah. I mean, my advice probably applies to older people. I mean, it wouldn't apply to a child of 7 years of age or whatever anyway.
But it could apply to a teenager. I was brought up on the book Pollyanna. At least you can be grateful that you didn't need the crutches that came in the mail for those who've read the Pollyanna story.
So, can I ask a question?
Please.
So I don't want a long answer, it's getting late, but I'm trying to think of a question that covers everything. And my question is this. Why is it that most people on this screen who stutter could walk outside and talk to their pet dog or cat and not stutter? And then they would come inside and they'd speak to somebody they know well. And quite possibly they could join 3, 4, 5 sentences together, no problem. But then there's a stutter. So what causes that? Why can't we be like the animal, the pet, and just speak happily?
Well, of course, with an animal or with a baby, oh, aren't you gorgeous? Look at you. We use a different voice. And is it a change to the voice that makes a difference? There was an author, Oliver Bloodstein, who discussed at one stage, changes in voice might impact, might be a reason why some people stutter sometimes and not others. And also other people have written about changes in the social role. Really, most of the time that you stutter is when you are in conversation with someone else. And you're not really in a conversation with your pet dog or with a little baby or whatever. It's a vexed question, and I won't rave on because I can give very long answers.
Michael O'Shea, Susan, thank you very much for your talk. I have a pain in my hand writing down what you said. But I just want to ask you something about fear, okay? Fear is the most overused word, in my opinion, in this community. Now, what I realised on my journey through stuttering, now I'm 70 years of age, and I started stuttering at 4. I got a severe beating from a nun in school. I didn't speak for 3 months. And when I did speak again, I stuttered severely. And I've spent a lot of time and serious money on my speech, and I gave it up at 35. I just stopped. I said, people, not like yourself, but other agencies and people, quacks that I went to, they just knew that Michael O'Shea would pay anything to get his stuttering fixed. And I had enough of it. And what happened after that is a different story. But I just want to share with people about fear, and I just want to ask your opinion on it. Nobody talks about the components of our verbal fear. And the components of my verbal fear was in a split second, panic. The next one in a split second was chaos. And the next one in a split second was confusion. The next one in a split second was verbal stress. Now, the next one is very, very important that we understand. The next one was verbal anxiety by 3. We don't...
Say that again. Sorry, say that sentence again.
The next one was verbal anxiety by 3. Okay? Now, we don't need to speak to stutter. Verbal anxiety, anticipatory anxiety, will look after that. And then we have in the moment anxiety. We just say, I want to say my name. And a severe block. I lost focus and connection with everything. The anxiety just wanted me to get out of there. And then
overwhelming.
And then the next one, which is a very important one that nobody speaks about as well, is post-anxiety. You know, post-anxiety is that if we went to speech therapy or speech pathology, it doesn't matter what it is. Post-anxiety is that you know yourself. I could have, I should have, but I didn't. And we beat ourselves up. And that dwell with us for years and years and years, depending on the trauma of the speaking situation we're in and our own self-talk with ourselves. Now, after the anxiety, the next one that trips in is verbal tension. And we don't understand this one either. Where is the verbal tension first? Is it in the mind or is it in the body? With me, in the mind.
That's a very, very good point. Yep.
So
that's a good point, because one of the Van Riper techniques, Van Riper wrote a lot about stuttering in the 70s, and one of his techniques was called preparatory sets and pull-outs. And so if you felt yourself about to stutter, what the goal was that you could pull out of that stuttering before you actually verbalized it. So you had to sort of pay attention to the pre-verbal aspects of that moment of stuttering. I mean, look, you've said a whole lot in a few sentences, and that's where cognitive behavior therapy comes in. You know, how do we recognize what we are worried about? What is it that you're afraid of? What do we fear? And how do we deal with that? You know, and people will often say, oh, I'm worried people will laugh at me. And you say, well, when did they laugh at you? Well, they laughed at me in grade 5 or grade 4 or whatever. And, you know, you're 34 and they haven't laughed since. So what is the likelihood that they will? But those things scar you, absolutely scar you. And so how do we change that? And it's, I think, recognizing the sort of danger signs where Ross Menzies at a conference not so long ago spoke about those things being wolf in sheep's clothing. You know, they're sitting on your back all the time trying to say, go on, you won't be able to do it. You won't be able to do it. How do we sort of knock it off and think, okay, I've got to get control of this? Much easier said than done. Yeah. And
I remember I asked Mark Onslow the question that David asked you about the dog and the cat. I asked him about a dog and a cat and a child, and he said the reason you don't stutter in front of your dog, Michael, is you know the dog is not judging you. Your cat is not judging you. And your child and your not.
That's right.
That's a big component. Thank you.
Sue, can I ask you a question?
Yes.
So what is your take on NLP? I mean, like I've been hearing about it for a long time, and it's been incorporated into speech therapy these days.
Has it been, did you say, or it has been?
It has been. I've been hearing about it.
Look, I've seen it used. I've read a bit about it. I haven't seen a lot of evidence for. I haven't seen any evidence for it in stuttering. I mean, the attraction to it is it's got neurolinguistics in it. And, you know, we know there's a neurological factor. So you think, oh, that's got to work. A lot of it is drill. A lot of it is motor drill. And if you think about it, for a lot of what you try to do when you are restructuring your speech is motor drill. And many people have done intensive treatment because the intensity changes the habit and ostensibly changes the motor pathways. Why do you think 3, 4, 5-year-olds do so well in therapy? Because they get consistent input in a particular way from their parents in terms of the Lidcombe program or Westmead or whatever they're doing, and it changes the motor pathways. It strengthens the fluency, decreases the stuttering. But it doesn't happen for all children. So, look, I haven't got a well-rounded opinion on it, Padma, so I am a bit loath to comment. But I do think that we have to be careful that we don't clutch at straws. And if I was a person who stuttered, I understand I'd be looking at everything, but I actually worry sometimes that people spend a lot of money with not a lot of outcome. And I know that for behaviour change, we need to learn a skill, we need to practice the skill, and we need to maintain the skill. And you can't always maintain it alone. And at different times, it's easier to do whatever the skills are that you're taught than at other times. Sorry, it's not a very satisfactory answer.
So it's getting a bit late. Are there any more burning questions someone wants to ask before we wrap up?
No, hi. Can I just say something?
Yes, go right ahead.
Thank you, David. It won't take long. One thing, I won't go through my history, but it's been mentioned, you know, preparing to speak and all that, and that's fine. And I just want to say there's no such thing as a cure, in my opinion. Once a stutterer, always a stutterer. But you can control it, you can learn to live with it, whichever way you want to go. But my experience too is it can surface all of a sudden. I've been in situations, they still happen, and they're not nervous situations as such that I'm aware of, but all of a sudden I stutter. Why? I don't know. Something in my mind, whatever, just happens. And it thankfully, these days, it doesn't happen often, but it still does happen. So I just wanted to throw that in to the mix. That's all.
Well, thanks for that, Neddy. It does, as a speech pathologist, you know, once a stutterer, always a stutterer, sticks in my craw and indicates we're not managing the situation fully, the condition fully yet. I don't agree with that comment, though, regarding young children. We've got great outcomes for preschoolers and young school-age children. And
sorry, sir, I didn't mention young children.
No, I know you didn't. No. Right. And I think that that's important to realise.
Okay, that's all right.
But why does it happen? Because you've got a body that's wired in a particular way. And from time to time, you're more fluent than other times and catches you unawares. It's a bugger of a thing. I don't have to tell you that.
That's right. That's fine.
If you haven't seen the chat, I hope to put the highlights of this on StutterTube Australia, because it'll be too long to send on an email to everybody. So look at YouTube, StutterTube Australia, and I'm going to put someone on the spot now to just give a 1.5 minute thank you to Sophie. A big round of applause for Sophie.
No worries,
You
I
go,
can
girl.
do that. No, thank you for taking the time not only to join the meeting this evening, but also to speak for so long and to take so many questions on the topic of stuttering. I'm sure we've all learned a hell of a lot this evening. All very interesting too, and a great summary on what's been going on. And a minute and a half, right?
That's okay.
Thank you,
Right.
Sophie.
And
Thank you.
and now
Thank you.
and now I'll